Hello and welcome. Let's continue answering the questions that might come at Prometric exam of pharmacists. Which of the following is the side effect of using thiazide diuretic? A. Hyperkalemia. B. Hypocalcemia. C. Hyperglycemia. D. All of the above. The right answer would be hyperglycemia. Thiazide diuretics can cause hyperglycemia as they impair glucose tolerance, and they also commonly cause hypokalemia. Next, which class of drug is primarily used to manage hyperlipidemia? A. ACE inhibitors. B. Beta blockers. C. Statins. D. Antidepressants. The right answer will be C. Statins, which they are the primary class of drug used to lower cholesterol levels in patients with hyperlipidemia, reducing the risk of cardiovascular disease. Next, a patient taking clopidogrel should be monitored for which potential complication? A. Thrombotic events. B. Gastrointestinal bleeding. C. Liver toxicity. D. Hyperlipidemia. The right answer will be B. Gastrointestinal bleeding. Clopidogrel, an antiplatelet agent, can increase the risk of gastrointestinal bleeding, so the patient should be counseled about signs of bleeding. Next, the main role of insulin in the body is to A. Increase glucose production in the liver. B. Facilitate glucose uptake in cells. C. Increase fat breakdown. D. Decrease protein synthesis. The right answer will be B. Facilitate glucose uptake in cells. Insulin's primary function is to promote the uptake of glucose into cells, especially in muscle and adipose tissue, lowering blood glucose levels. Next, which of the following indications require monitoring of thyroid function tests? A. Simvastatin. B. Levothyroxine. C. Amiodarone. D. Metformin. The right answer will be C. Amiodarone. Amiodarone can cause thyroid dysfunction due to its high iodine content and should be monitored with thyroid function tests during treatment. Next, what is the primary mechanism of action of beta blockers? A. Vasodilation. B. Blocking beta adrenergic receptors. C. Inhibition of angiotensin converting enzyme AC. D. Calcium channel blockade. The right answer will be B. Blocking beta adrenergic receptors. Beta blockers work by blocking beta adrenergic receptors, leading to decreased heart rate and blood pressure, and reduced myocardial oxygen demand. Next, which medication is classified as long-acting insulin? A. Glargine. B. Aspart. C. Lispro. D. Regular insulin. The right answer will be A. Glargine. Insulin glargine is a long-acting insulin that provides steady level of insulin over a 24-hour period, which is used for basal insulin therapy. Next, a patient with chronic obstructive pulmonary disease, COPD, is prescribe a combination inhaler containing a beta agonist and corticosteroid. What is the purpose of corticosteroid in this combination? A. Provides immediate bronchodilation. B. Reduces airway inflammation. C. Increases mucus production. D. Acts as a rescue medication. The right answer will be B. Reduces airway inflammation. The corticosteroid component in combination inhalers helps reduce airway inflammation, improving overall lung function and reducing exacerbation. Next, which of the following medication is used to treat opioid-induced constipation? A. Naloxone. B. Loperamide. C. Methylnaltrexone. D. Document. The right answer will be C. Methylnaltrexone, which is a peripherally acting mu-opioid receptor antagonist used to treat constipation induced by opioids without affecting pain relief. Next, a patient with a history of heart failure is prescribed furosemide. What is the expected outcome of this medication? A. Decreased blood pressure. B. Increased potassium levels. C. Fluid retention. D. Decreased heart rate. The right answer will be A. Thank you so much for watching. Please don't forget to subscribe, like, and share. And wait for us for the next part to complete answering questions about Prometric exams for fun.